I was like, oh wow, yeah, it's meant to be really good.
It is
Course,
meant to be a really good cute club. Is it popular?
Very, very.
I'll get there, and I'll probably end up doing an intro. It's probably like, does it like build you up to?
Yeah, very much so. Like I couldn't hold my body weight a few years ago now. I can cut myself up and down.
Wow, I've got zero before. But no one forgot me saying.
I do. I've just managed to do the plank yesterday for a minute.
Oh wow, that's good.
Which was like, that took me a while to get to that point. And side plank on the feet, not on the knees. So thank God for that.
Now, just to warn you all, we are recording this. There is a camera here which is 360. There is a camera there which is picking you up. And there's a camera behind you.
You see, and he did that before I volunteered to come in.
And there you go.
Where is this being streamed?
Let's just keep it to his own entertainment.
There you go. That's the answer. It will be kept in the Alder Hay Academy archive under the subsection EDC. The only people who can access it are those in ED and me, and that's it. So it's for your reflection, and you go, oh God, what was that thing we did? So you can watch it again anytime you want.
As horrific as it is.
However, if it counts and it's hot chronic, it gets to
You can accidentally press delete when you're running viewing yourself.
No one can download it, no one's watching it except me.
We don't pay any royalties though.
Oh,
Oh.
especially the shit. Who's going to be the team leader?
Pardon?
Who's the team leader?
We haven't allocated yet.
Is anyone else coming in?
I think Charlotte's coming in. Charlotte.
She's running it.
Yeah.
Well, she better be here.
And Jess is coming in.
I think Jess was just seeing an indication.
So,
Whoever's team leader can wear this.
so I think let's get the, because I don't know what this in is, let's get free.
No.
No, is it
Oh, I don't want that patient. No.
as in, is it going to be a pre-alert, because then it'll be me? Is it somebody that's rocked in?
We'll tell you what it is.
So that's why he's trying to be like, who's the team leader? And
Give them a
just seem
microphone so you can pick it up.
It's got a little clip, Charlotte.
Is anyone else coming in or should
Russell has lots of toys today,
Who
which
wants
is
to
very
clip somebody?
exciting.
Is everybody here?
I think, yes, I think Jess is coming, but yeah, you shut the door.
I'll just shut that one off.
Yeah, we're really cool.
And I tend to come in
You
later.
see, you're not here, it got this law look at me, and I ended up kind of dealing with something that I've never dealt with before in my life.
Wait a minute, I've got 2 months pizza experience.
I know,
2.5 now.
trauma.
Oh, is it
Trauma,
trauma?
trauma.
Oh, that's fine then.
Right. I don't think it will
I
be.
don't know if this microphone's picking up properly because all I can hear is wow, 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 wow.
Angela, yeah. You know what, I need one of those. That's a really good thing to have.
Good, it is good. From Netflix, chemistry, she's and everyone should have one.
So it's passing.
Especially if you can't look at
I know, and you're looking at groin areas, yeah.
Oh my God.
Yeah.
Russell, where can I stand?
Anyway,
She. I need to get one of the...
David.
start recording.
It's okay, I'm abysmal with names.
I am terrible, that's why.
That's what I was about to do. Introductions, so no, just because no risk of book. So, she is going to be starting off. Kay is going to be coming in, so I don't know if you want to... Are you going to transfer? Actually, you've done... I'm going to give it... Well, you can help, but I'm not going to. So she's going to be leading the
Okay.
Kay coming in. So I'm part of the consultants. We're doing a sim, which we do... who's done a sim? How does that? Yeah, a few people, nursing students, yeah. So do you want to just introduce yourself briefly so everybody knows who everybody is? From the start, so
Yeah. Should we first?
So if you just introduce yourself.
I'm Tima.
Yeah,
Vampire Gardeners.
perfect.
So I'm Anna, I'm a sister here, but I haven't been a sister in A&E for long. I've not been in A&E for that long, so sort of new to A&E, but Francis.
I'm Angela, I'm one of the advanced nurse practitioners.
I'm she, I'm an ST2, I'm an ST2. I'm Kaylee, I'm an ST3, and currently I'm a Reg. I'm back in the student. Ellie student. I'm Emma, and I'm a healthcare assistant.
And then medical students, what your name is? Saeed.
Yasmin.
Yasmin. Okay, perfect. Right, so we'll do the sim as is. So Russell has got lots of interactive, real life stuff, so it's going to be as true to life as we can make it. Okay, so so you've had a standby call for a 6-week-old baby who's coming in, and well, you haven't really got any other details, but they're 5 minutes away and they're concerned about the baby. So less responsive than usual, and they're worried, and that's all you know. So you're going to be team leader. Angela can be your person, hands-on person. Kaylee is busy upstairs, so Kaylee's not going to be here at the minute, but Kaylee will come and help you at some point. You've got your nursing team, and yeah, that's it. So if you want to organise yourselves, you've got a couple of minutes.
Did you prep it to the board or will I see it at the moment?
Okay, so we've got 6 months old.
6 weeks or 6 months?
6 months. 6 weeks. Sorry, weeks.
6 weeks. 6 weeks. 6 weeks.
6 weeks.
So we've got 6 months old baby that is unwell.
Yes, so you've
All
got your
we've got
age,
information-wise.
estimated weight, plastic on these and
Are you
sugar
going to
there.
lead it? Do you want me to lead it?
Weights and things.
Yeah, we'll do it. We'll just work together.
Yeah.
So
Should I assess this one when you come in?
Make sure there's a SAT code.
what we can do is we can get you to come to paramedics when they come. Parents not being here, so we can get someone to speak to mum when they come, just to get as much information as possible. We'll see what we can do. If you want to get that information, team lead, and I'll do the ABC top to toe. Yeah. So I think access will be quite a priority because everything is 6 weeks old could still the factory group B strap. Really, because you've got like from maternal kind of that's the big one. I think the sections are main thing, so I think it's more kind of access to fluids, blood sugar, things like that, just checking to see if we need to give any medication intervention, things like that. I think that'll be on there. So that's the main things that we need. So the main things we're looking at is fluids, glucose, I think it's like cefataxine.
Yeah,
Cefataxine, yeah. So I think it's accessing antibiotics and fluids if the child's unwell.
And you have to be working out the number. Are you
Super. Are you all right writing them on the board? Is that okay? It's a 6-week-old baby. Yeah. So if we go from the weight of 5 kilos, yeah.
Yeah.
So that's all worked out on that, isn't it? Yes, it's already worked out, isn't it? Yes, it just needs writing on the board so we know. Yeah. I write down. Yeah. Yeah. Yeah, I think so. Yeah, because that's the right age. So we've got 6 weeks. It falls into 2 month category. Yeah. 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 But you have to just write those up on there. So can I? Of course you can. Yeah. Right there.
So all the options come on the screen at the bottom.
Birth history is massive. Yeah. Preterm, risk factors when treated, and postnatally and things like that. So I think if we can get that from us, this is sort of an idea about prematurity, gestation, whether given any intervention after delivery, looking at any risk factors like maltreated and things like that. Yeah. And then feeding and things like that, what they've been doing about 24 hours. I'll just put A to B, sorry, A to E, and then we'll look at gain access to things, which we'll have to do.
Do we want to prep out just in case if you try to
No, possibly. We've got it all there, haven't we, anyway? We've got it all there.
Okay, so I'm one of the paramedics. So this is Jaden. He's been found in bed. Mum just said he wasn't making good feed, and she's just really worried about him. He's not been very responsive in his SUC, and we haven't been able to do anything. I'm afraid we just scooped him well. So
Is Mum with you?
Mum's just outside crying.
Okay.
any history on birth history or antenatal?
So he was a normal delivery at term, no problem. He's been fine. A bit sort of colicky and stuff. He's been okay, but then last 24 hours just not been quite right. And overnight, not fed as much as usual, and so she just couldn't wake him up when
Do you know if they're breastfeeding, bottle feeding?
bottle
Bottle
feeding.
feeding. And do we know if the baby's been admitted for any antibiotics or not have anything?
No,
And so you mentioned no complication after birth, any complication
No,
before birth?
no, all fine.
Thank you.
Okay.
So let's just put these markers on. So I'm presuming that we're going to...
Is the airway patient? I can hear noises, so I'm looking in. Can I see anything to suction?
No, it's nothing you can see.
Nothing to suction. So we're just putting him on a little bit of oxygen because of noisy breathing. Okay. Is it steaming up the mask?
Yep, it's
Yep.
in the mouth.
Okay. So, breathing wise, is he having equal breath,
Yep.
chest movements?
So equal air entry, so good chest movements.
You say equal air entry, so I'm
Yeah.
listening in.
Yep, so air entry, air entry, air entry, air entry.
And I'm listening to heart sounds.
Heart sounds are okay, there's no murmurs.
No additional sound.
No.
Okay, so
You
good air
can
entry.
actually hear it.
Right, circulation wise, 1, 2, 3, 4, 5.
So it's 1, 2, 3, 4 seconds.
Okay, I'll carry. Do you want to get the IV access ready just whilst I'm just carrying on the ADC? Okay, so we're going to have a good look at it. And pulses, can I feel the femoral
So you can
pulses?
use stuff in here. Yes, so you've got good femoral pulses.
I've got good femoral pulses, okay. And as I'm looking at the body, can I see any rashes or bruises or marks or anything like that?
No, nothing you can see.
Okay. And movement-wise, is he moving?
So
Is he quite floppy?
he's
What's
quite
he-
quiet and fluffy.
It's quite quiet and floppy, okay. Have we got some observations? So we've got heart rate 146, oxygen's 96, that's with 100% non-rebreathe, pulse 147, respiratory rate 41, and this is probably a blood pressure as well.
And temperature, please?
Temperature is 37.5.
Okay. Alright, and I can't see anything else of concern. What's the abdomen like?
Abdomen is soft.
Not
No,
tender.
but doesn't seem to be. It's just quite quiet. It's not really responded to much to do, to be honest.
Okay, so GCS wise, what would you say it is?
Did you get his cut detail?
I did, it's 3 to 4 seconds. Okay. And what I'm seeing is what I'm seeing. Okay, alright. One of his pupils are enlarged, his left pupils are enlarged, more so dilated to his right. Are they reactive or is it what I can see?
They are, as you can see, so
Okay, alright, probably put double two. That's okay. Can someone put out the double two, that's okay.
Well,
I'll
thank
put
you.
this out.
Cardiac arrest resource A.
Okay, just because of the, just we need some extra support if that's okay. Yeah, so then we make that call out. So one pupil is more enlarged than the other, alright, so what's his blood pressure?
if you touch the thing, it should. Yeah, just touch it, yeah.
Okay, so he's making some abnormal movements, okay, so he's twitching and jerking, his two upper limbs are jerking, his lower ones aren't. Okay, so we do need probable IV access, so are you happy to try and have a go at doing that for me? Okay, in the meantime, could we get some rectal diazepam, if that's okay? Thank you.
No, so just you're going to get your green cannula in.
Have we got a yellow one? Do you want to bring over the cannulation equipment? Yeah, just wheel it over and wheel the entire thing.
How is the right people? Is that reactive?
So both for the right pupil's small. It's probably a size 1, and the left pupil probably a size 6. And they're not reactive. Are they reactive when I shine the light into them?
Not really. The
No.
left one is dilated. The right
Okay.
reacts a little bit, but
Right,
not.
can I see any bruises or any swelling or anything to the head at all?
Not really. There's a little red mark on one side, but nothing.
Which side?
The right side.
The right side, okay, but nothing else. Have we got IV access?
Yes,
Okay,
yeah,
can we
so
get
that
blood
goes
for the
in.
sugar?
we've got some blood gas, we've got all the septic screen.
Okay.
And the glucose, yeah, so we just need the gas.
I've got 5 milligrams diazepam.
Right, okay. Is that okay for his age? Do we know?
Do we use, not use village?
If we've got access, yeah, we just didn't have access, that was all.
Okay, yeah, so
So
we have access.
we have access now, okay, so we'll go to the Lavazza if that's okay.
Okay.
0.5. Okay, and we probably do need to give them a bolus of fluid as well, so if you can, do you want to try and get another access out while we get the fluids? Okay, so let's just review everything that we've done so far. So an A to E examination, we've noticed that his GCS is reduced, his pupil, his left pupil is enlarged, dilated, his right one is small and restricted, and they're both quite sluggish. He is having a seizure, his upper limbs are shaking, his cat refill is 3 to 4 seconds, so we need IV fluids and we need to give some lorazepam just to kind of control the seizures and review once he's been given that medication. We probably need to look at giving some IV antibiotics as well to cover for any sepsis.
So we're thinking of sepsis at the moment and also potential bleeding in the brain.
Yeah, increasing intracranial pressure, also because his pupils are dilated. Yeah, his left one, also his right one is full. So we've asked for help. They're on their way. Okay, we just need to get the medication into the system. And their parents, do we know where they are at the moment?
Mum's in the emergency room, she's just really upset. She's not going to be
Okay,
able to
probably
answer this way.
Paramedics whilst there, straightforward with history, no complication, not quite sure if there's any GM, but as far as we're not, no infections. No free, feeding has been well until 24 hours earlier, gone off a little bit feed, and then in our nurse once in November.
And where was he found by the paramedics, did you say?
It's just in his Moses basket.
No, in his Moses basket. Okay, so there's a little redness to the left side of his head, so we have to also exclude safeguarding either and non-accidental injury as well. So management-wise, what we're doing so far is we're going to give him a fluid bolus.
So we've sent off some blood, we
Yeah.
are waiting for the IV medication
Yeah.
for the seizure,
Yeah.
and we are going for that antibiotic at the
Yeah.
same time, which have
We have, yeah, we have. There's a bit of a list that needs to be done. We've asked for help to come down. Is his airway remaining patent? Because I know he's at 100% on rebreathe. His saturation is 98% in air. Do you need to think about airway at this moment in time or not?
So he is breathing for himself at the moment,
Yeah.
maintaining his own airway.
Okay, so at the moment we don't need to worry about his airway management. His BP is stable at the minute at 72 over 42. But we just need to get the medication in the system. Thinking while we're waiting, do we consider the big rectal diazepam? How are we with the phenytoin? Oh, not the phenytoin, I apologise.
And still around the pamphlet.
Okay, so that's going to be given over 3 to 5 minutes. Okay, so let that work.
Oh, okay.
What's his, have we got a gas?
Yeah, so your gas comes back, your sugar is 2.3,
Sugar's 2.3.
pH is 7.1, everything else looks okay, he's got a respiratory acid.
From his gas, yeah, okay. So we just need to look at his glucose as well, and maybe giving a 10% 2 mils per kilo of glucose.
We would just give 10 per kilo anyway, standard.
I think because his glucose is low before the flu bolus, can we give some glucose, please? 10%. Yeah, so that's 10 mils, please.
BM 2.3.
2.3. So before the flu bolus, yeah, glucose 10 mils.
Okay. How many litres of oxygen?
Is in 100% non-rebreathe.
Dextrose. So it's estimated 5 kilos, so 10 mils of dextrose.
Okay. So what we'll do is we'll look at getting a
Dextrose, 10
separate
mils.
IV access while we're waiting.
Dextrose.
Is that all right?
So we have two.
Oh, we've already got some
Yeah,
10 mils
dextrose.
Okay. All right.
Sorry, have you had the lorazepam yet?
He's just had the lorazepam, yeah.
10 kilo of fluid?
Yes, please.
Yes, please.
Is
Okay,
that,
so
is
50
that
mils.
Is that the point? Is that the 0.9?
That's 0.9, so it's had 2 mils per kilo of dextrose and it's
Yeah.
had 50 mils, 10 per kilo of saline.
Okay.
Seizure spot.
And we just need the IV antibiotics as well, the IV peptidine, please.
Okay.
So let's reassess. Yeah, so let's go to the top. Airway, is he still making those noises?
Yeah, so he's a bit quieter than he was.
Okay, that's okay. But he's still maintaining his airway, so his saturation's a nice look. So we just need to look at securing an airway. I'm going to do a bit of a position movement. Does that help at all?
Yeah, so that does help.
Okay.
Should I get an Odell, should we just put one in?
We can see if they'll tolerate it, or Odell, yeah. We'll see if we've got some. With the breathing, is second down? Second tray down, yeah. And it might be the Lavaz and Pamela had as well.
Could we have another cap refill, please?
Charlotte, do the tap refill. 1, 2, 3,
No,
4, 5,
3 seconds.
2, 3. That's 3 seconds after the blue bolus.
You can get Odell up to you.
BP as well, please.
Yeah, okay. Right, so that's probably Cefotaxime, 250 milligrams.
Thank you.
Bolus.
Did you want to
5 over 42.
Thank you.
tell us where you're measuring from?
From the Georgia mouth to the corner.
You can use that, so.
Let's see if it tolerates it. Have you got, yeah, what do you want to move his tongue out the way? Does it tolerate it? Is it tolerated?
Yes, we tolerate
Yeah,
that.
let's put the oxygen back on. We should just reassess, okay? Alright, so is the mouth steaming up with the
So
oxygen on?
not really, you've taken the odd gasp, but probably 8 breaths a minute.
Okay, okay, so you just take over, yeah. Let's just keep that in. Let's see if we get good ventilation.
Well, I'm not thinking 100% like that.
You want to do 2%? Yeah.
If you're not getting good ventilation, take the Goodell out. Do you want to just move yourself around? Are you comfortable like that, yeah? Okay.
Should I hold then? Do you want to hold while you come round the back?
Yeah.
Alright. Should I hold in? Do you want to?
Yeah, you happy?
Yep. So I'm positioning his head,
His heart rate's dropping a little bit as well.
suction and everything there. His heart rate's dropping a little bit, okay. We're giving some ventilation breath as well, isn't it?
Okay, so is the bag filling up?
It's not well, partially, yeah. Can put some more oxygen on. Yes, alright, thank you. You happy to? And I'll hold still and we'll have a see. What's his colour like at the moment? What can we
It's
see?
quite pale.
Right, okay.
Do you want another bolus? Is his cap refill better?
His cat refills still about 3 seconds, so yeah, can we get a
Another
bolus,
bolus, yeah.
please? Yeah.
So finger mills, saline, so second 10 per kilo bolus of saline, 50 mils.
Are we getting equal air entry? That rise and fall of the
You're not
chest?
squeezing the bag at the moment.
So if your bagging circuit is not working, what else can you use?
Just do it.
Do we have like a normal new puff that we...
We don't have a neopuff, but what else do we have?
Do we have a bag of
Your
mash?
nurses are here, they might be able to help you.
Do we have a bag of mash?
Have a mash?
Yeah.
Look at your patient,
I've actually...
have a look at your bag. He's hyperinflated and he's got too much pressure in the bag. Right, that's better.
Just to squeeze the back of the bag a little. And
Yep,
squeeze it,
so-
just escaping, yeah. Okay. Is that better? The tongue include it yet? And squeeze, that's it.
Very closely occlude the bag.
Not too much, yeah. That's it. Is it working now? Got another look. On the bag?
Is it working?
Yeah, it's working.
So
I've got it
look at
down there.
patient, look at patient, look at your arms.
Yeah. Yeah, we've got equal rise and fall of the chest.
Okay?
Do you want me to hold the mask?
I'd probably just, yeah, we've got good, it's probably someone to take over, if we've got quite a good position.
Okay, so Kaylee has arrived, she's been busy upstairs, she's come down to help. So Kaylee is who she is.
Yeah. Hi guys. Hi Kaylee. So, what's going on? Do you need a hand?
Yes, please. So this is a 6-week-old that's been brought in by ambulance. Birth history-wise, nothing significant, normal delivery, nothing postnatally. Been feeding well by bottle until 24 hours ago. Mum noticed that it's gone a bit off feeding and was a bit more unresponsive this morning. That's why it was brought in. Since it's been in, he has been assessed in human he was a little bit unresponsive at the beginning, breathing was fine, but we noticed in ample pupils, more constricted on the right side with a small rash on the right forehead. So we have our current working diagnosis is crury, intracranial bleeding and crury sepsis.